Hi, this is Saidi. I'm going to be presenting on my cranial nerves, and I will explain the 12 cranial nerves on my recording. But for the presentation over here, I will just go over my focused abnormality, which is the Bell's palsy. Bell's palsy occurs when inflammation at the facial nerve impairs peripheral function. The facial nerve becomes thickened with an edematous perineurium and diffuse infiltrate of small round inflammatory cells between nerve bundles and interneural blood vessels. Myelin sheaths undergo degeneration. These changes may be seen throughout the bony course of the facial nerve. However, nerve damage is maximal in narrow labyrinth part of the facial canal where edema causes nerve compression and the tenuous blood supply adds to the damage. Here is a picture representation of cranial nerve number 7, which is the facial nerve. That is the nerve that is affected when somebody has Bell's palsy. Bell's palsy is usually identified by a weakness or paralysis of the muscles of the face that, as a damage. Symptoms of Bell's palsy include drooping eyelid, absence of nasolabial fold, drooping mouth, dryness in the affected eye or mouth. Uh, this is lacrimal and submandibular. Hypersensitivity to loud noises and loss of taste sensation. And here's a picture representation of what Bell palsy would look like. Diagnosis of Bell's palsy is done by identifying problem with the facial nerve and not a stroke or brain tumor. Most people recover within 6 months. Some people develop permanent weakness and paralysis. Severe cases, people are prescribed corticosteroids that can reduce nerve inflammation. On the next slide will be my cranial nerve assessment, including a Bell's palsy assessment. Differential diagnoses for Bell's palsy includes herpes zoster, Lyme disease, otitis media, mastoiditis, cholesteatoma, Guillain-Barré, HIV infection, sarcoidosis, Sjogren's syndrome, tumor, stroke, Wilkerson-Rosenthal syndrome. If you're interested in delving more into these differential diagnoses, follow my citation um, from Up to Date, and there is an extensive explanation of the diagnosis. Here are my references, and thank you for watching.